What are the risks for developing secondary osteosarcoma? Imagine a person who has already battled cancer or has a bone condition. Sometimes, years later, a new type of bone cancer called secondary osteosarcoma can develop. This isn't common, but understanding what increases the risk can help with early detection and prevention. The biggest risk factor is exposure to radiation. When someone receives radiation therapy, especially at a young age, it can damage the DNA in bone cells. This damage can lead to secondary osteosarcoma years after treatment. The risk increases with higher doses of radiation, typically around 50 Gray, and even lower doses near the edges of radiation fields can contribute. Usually, these cancers show up several years after radiation treatment, and younger patients are more vulnerable. Genetics also play a significant role. Some inherited conditions make people more prone to developing osteosarcoma. For example, Li-Fraumeni syndrome, caused by mutations in the TP53 gene, increases the risk of multiple cancers, including osteosarcoma. Similarly, hereditary retinoblastoma, linked to mutations in the RB1 gene, raises the chance of developing this bone cancer. Other rare syndromes like Bloom syndrome and Rothman-Thompson syndrome are also associated with higher risks. These genetic factors can predispose someone to develop osteosarcoma either on their own or after other treatments. Chemotherapy is another piece of the puzzle. Certain drugs used in childhood cancer treatments, especially alkylating agents and topoisomerase Roman II inhibitors, have been linked to an increased risk of secondary osteosarcoma. The risk tends to grow with higher doses and can work together with radiation to boost the chance of developing this cancer. Underlying bone conditions can also set the stage for secondary osteosarcoma. For example, Paget's disease of bone causes abnormal bone growth and remodeling, especially in older adults. This condition significantly raises the risk of developing osteosarcoma, often in bones like the pelvis. Other conditions such as bone infarctions, sickle cell disease, and decompression sickness have also been associated with increased risk. Sometimes, osteosarcoma has been reported near orthopedic implants, but a direct cause-and-effect relationship hasn't been firmly established. Age and growth factors matter too. While primary osteosarcoma tends to affect teenagers during rapid bone growth, secondary osteosarcoma usually appears in older adults. Interestingly, radiation-related cases are more common when radiation is given at a younger age. It's important to note that routine imaging tests like X-rays and CORT scans use much lower radiation doses than cancer treatments and are not linked to a significant increase in osteosarcoma risk. Overall, secondary osteosarcoma remains rare but is a vital consideration for cancer survivors, especially those who have had radiation or specific chemotherapy treatments. In summary, the main risks include prior radiation therapy, particularly in young people, genetic predispositions, certain chemotherapy drugs, and underlying bone diseases like Pagets. These factors can cause changes in bone cell DNA and growth regulation, increasing the chance of malignant transformation into osteosarcoma. If you have a history of cancer treatment or bone conditions, discussing your risk with a healthcare professional is essential. Regular checkups and imaging can help catch any issues early and improve outcomes. Always remember, individual risk varies, and personalized medical advice is the best way to stay informed and protected.